Good afternoon, everyone. Welcome to August's virtual Veg Edge. My name is Carrie Stewart. I am a registered dietitian with the Heart Resource Center over at Spartanburg Medical Center. And this month, I'm really excited to have special guest Dr. Cindy Watson, who is a physical therapist, here with us. And she is going to speak a lot to bone health. But first, I'm going to let Cindy introduce herself before we talk about what we're going to make today.
Well, thanks, Carrie, for inviting me. I am a physical therapist at Pelham Medical Center in the outpatient rehab department. And I'm also an assistant professor at Anderson University in the School of Physical Therapy. So we're getting ready to start a bone health program here at Pelham. And we thought it'd be interesting to talk about nutrition. And then also, I was going to cover today some of the myths about osteoporosis. So kind of bring those two things together.
That's great.
A little bit about my background. I have advanced certification in orthopedics and also bone health. So osteoporosis and osteopenia is kind of part of my expertise.
That's great. I know I'm going to have a lot of questions for Cindy. And if you do too, we are lucky to have Terry Donahue in the back who is running our question and answer segment. So please feel free to ask Cindy anything while she is here in front of us. Take advantage of this resource. So I know if you don't have any questions, I certainly will. And so obviously with the discussion on bone health, we wanted to focus on a really calcium-rich meal. And being that this is Veg Edge, where we are not using any meat or dairy ingredients, there's a lot of myths, I think, and facts that go along with the plant-based foods and calcium sources as well. So we are going to prepare a quick curried collard green recipe, and I've actually adapted it to enhance the calcium-containing foods as well. So the first thing people are probably thinking is, you can't cook collard greens quickly, and I am here to show you absolutely you can. So I should have done this before, but I'm going to go ahead and turn my pot on here because our stovetop takes a little while to heat up. So I've got my stove on medium, maybe a little higher than medium. And what we're going to do there is just saute onions and garlic. So before I do anything else, I am going to follow good food safety practices and wash my hands first. So let me do that.
And I was telling Carrie, I've never made collard greens, so I'm excited to see how you do this.
Yes.
And these look really fresh and really beautiful. I think you said you got them from a local farm.
Did.
So that's awesome. And just a little bit about Carrie already alluded to the fact that vegetables are a good source of calcium. Collard greens are one of the highest sources of calcium when it comes to vegetables. But another thing to think about with calcium is about 78 to 80% of the American diet, we get calcium from dairy products. So I'm just going to chat a little bit about that. Is that really some of the best sources of calcium that are non-vegetable are yogurt, ice cream, milk, cheese. So those have a lot of calcium in them. And so that's something to be thinking about also to get kind of a well-rounded diet throughout the day.
Yeah. All right. So the first thing I'm going to do is start by cutting up our onion and our garlic so we can get that sauteing. I do have a whole onion here. This is a pretty big onion, but so I may just start with half of it and we'll go from there.
Carrie, does it matter if you use like a white onion or?
It doesn't.
Okay.
Nope, it really doesn't. It's a personal preference thing, and honestly, we talk a lot about different colors, so that is something that we can look into a little bit later to exactly how many colors that I am using in this recipe. But if we wanted to incorporate some purple, we could absolutely use the red onion there instead. And red onions have different phytonutrients, different plant compounds because of the purple than yellow versus white. So by eating those variety of even the same vegetable or the same fruit, just different color, you actually do get different nutrients. So kind of switching it up is a nice thing. All right. So I'm just going to dice up this onion here. And try and use my claw method, keep my fingers out of the way. And I think, what you'll never find me doing is dicing it up like the fancy French executive chefs, because that is not my method. But I like to say whatever method is safe and effective for you is all that matters. So let me try and scoop away some of this onion here. So it's nothing fancy, just kind of a small chop here.
One other tiny thing I just want to mention about calcium from dairy products is this is not one of the myths I'm going to be talking about in just a minute, but a lot of people are worried about dairy products from the standpoint of high fat content, but just keep in mind that you will still get the same amount of calcium if you use low fat milk or low fat cheese. So so that you're not worried about the caloric part of
That's a good point.
eating dairy.
Yeah. Now, one of the things that I have actually been learning a lot more is the absorption rate of calcium.
Mhm.
So I don't know if you've heard this or not, but one of the things that I've learned is that we don't absorb all the calcium from dairy the same as we do low oxalate plant foods. So collard greens are one of those low oxalate greens. So we actually are going to absorb almost 100% of the calcium in the collard greens.
That's interesting.
Which ends up being about equivalent cup for cup to that
Oh.
dairy because our body just isn't able to. I'm not sure if it's attached to something in the dairy product that makes it harder for us to absorb.
Right.
Spinach is one of those things where you might read the nutrition facts label and it looks like it's very high in calcium, but it is also a high oxalate food. So the oxalate is going to hang on to that calcium and we are not really able to absorb that into our bodies. So that might be a word that you hear me bringing up kind of a lot. And that's part of the reason that I think plant foods have gotten that confusion about not really having calcium at all, or it's not very absorbable. And that is a myth in and of itself too. So part of the reason we chose collard greens is because we're going to get basically all of that in there. So that's kind of an interesting fact there. All right, let's see where our pot. Okay, I think our pot is coming along here. So I'm actually gonna scoop up my onions probably and just put them in this bowl. And that way I can clean my station and do the garlic as well. Okay. And then Cindy's gonna help me out by starting to saute our onions and our garlic. So one of the things I'm gonna do is actually flip my knife over. A lot of times what we do is we take the knife and we scoop the blade into our hand and then put the food in the pot or in the bowl. Yeah. And that actually dulls the knife as well. So I'm actually going to flip it over and then the pointy side is away from my hand and I'm not dulling the blade of my knife.
One other thought about calcium that just kind of occurred to me is that it's important to take calcium throughout the day because our body doesn't make calcium. And so kind of some easy things that you can think about is that if you have collard greens on your dinner plate, that's probably not the time to think about taking your multivitamin or even your calcium supplement because we can only absorb about 500 milligrams at a time is my understanding. And so you wouldn't want to have your, yogurt and milk and take your multivitamin and your calcium supplement all in the morning because your body will just get rid of that if you take about 500 milligrams at a time. I'm glad you brought that up because I actually had that as a point to make as well. That the 500 milligrams, that's about it. So, and that's the best way I can explain that is because absorption from your intestines and your digestive tract is kind of like we're looking for an open door. And so we only have so many doors that allow those minerals to enter, and a lot of them use the same door. So if someone's already at one door, like magnesium or like potassium potentially, the calcium can't get in and it has to find another door. So that's part of the reason for that 500 at a time. And you make a really great point that if we're going to pay for the supplements, we want them to work. We want them to know that we're absorbing them. So if we're going to take them all at one time, we're really kind of wasting that money, which they're expensive. So that's not ideal either. All right, I am going to, many of you have seen me do the garlic before. Some of this was actually already kind of broken apart and a little bit easier to get off the stem here, but I'm going to take my palm of my hand and roll into these other 2 cloves of garlic, not only to flatten them so that I can cut them up a little bit easier, but also to get the paper peel off in a pinch. So there we go. All right, now I'm just going to mince up our
garlic very fine. And actually, Cindy, while I do this, I usually like to put the onion in a little bit sooner than the garlic just to make sure we don't burn the garlic. So if you want to just coat the bottom of our pan in a little bit of olive oil here, we have it in our fancy squirt bottle. And then add our onion. I will start working on our garlic. And here is a spatula to stir it with. Are you a garlic person, Cindy?
I do like garlic.
Okay, good.
In fact, I have a friend who's allergic to garlic. I don't know how she.
That would be tragic.
I don't know what that's like. Yeah. Just talking about calcium, one other thing to think about is that our bodies need calcium throughout the day. We have to have calcium in order to send nerve impulses, contract muscles, have our heart function correctly. So unfortunately, because it's so needed by our body, if we don't take it in our diet, what happens is our body actually takes it from our bones. And so 99% of the calcium in our body is in our bone tissue. And so that's why, kind of circling back to what we talked about, if you have calcium in your food at a certain meal, go ahead and take that supplement at a meal where you're not eating calcium, because if you don't have calcium in your bloodstream throughout the day, your body will take it from your bones, and that makes your bones weaker over time.
Yep. That's definitely something we all want to avoid.
Yes.
Do you feel like most people potentially need the help of a calcium supplement?
You know, it's really individual. I think a good way to do that, and of course, you know better than I do about this, but is to just write down what your regular meals are for a few days and see what your patterns are. You know, like I typically don't have dairy or a dark green vegetable, obviously, in the morning.
Yeah.
So I take my calcium supplement in the morning.
Yeah.
But really, I do that with a multivitamin. And that's another thing people forget is don't forget to look at your multivitamin, because if it already has 500 milligrams of calcium, you don't want to take your supplement at the same time. So
that's a great point. All right. How are we doing over there? We're getting there. Pretty good. Yeah. I might just, no, let's just go ahead and clean up my workstation a little bit. All right, here it comes.
One other quick thought while we're talking about supplements is just that as you get older, your absorption of calcium as a supplement decreases.
Okay.
And so it's better over 50 to think about taking calcium citrate, which is over the counter, would be called Citracal.
Okay.
So over the age of 50, just because if you take calcium carbonate, which is another common form, you have to have a lot of acid in your stomach to break that down. So it's harder for people to break down calcium carbonate as they get older, just because the amount of acid in your stomach changes over time.
Yeah, that's a really important point. And I know sometimes these things can be complicated to figure out, oh, I need to take this now. And one of the things that hopefully we'll get to discuss too is maybe the relationship between vitamin D and calcium.
Yes.
And vitamin D is fat soluble, so it cannot enter into our body unless there is some fat there. So similarly, especially with maybe some cardiac patients that I work with a lot, they'll tell me they take their vitamin D in the morning with their banana, skim milk, and Cheerios. And there is not any fat in there at all. So if we're taking that vitamin D with a good source of fat, we're going to absorb about 30% more of that too.
Oh, that's great.
So
yeah,
that's another one that goes hand in hand with this that we want to be paying attention to.
Yeah.
I think. So
great.
Once you know and you get it down, it can be a lot easier. But yeah, we just want you to get the most out of these if you are taking them, and the most out of your food.
Absolutely. Food is the best way to get calcium.
Yeah. Body knows that, I think. All right. I'm going to cut up the tomatoes I can put back in a bowl. So I think I'm going to go ahead and cut my tomatoes next first before I tackle these big old collard greens. So I am actually going to use a serrated knife For the tomatoes, I find that anything with a waxy peel like that, so a bell pepper, an eggplant, a tomato, if you use a serrated knife, that kind of catches into that waxy, thick skin, and it makes it a little bit safer to cut.
Yeah.
And most people don't use their serrated knives very often, so they're usually pretty sharp.
Yeah,
So they go right through everything.
Think about using it for bread, but
Exactly. Yeah, exactly. So, I'm going to cut my ends off there, although I don't really want to waste anything. So the tomatoes in this case are also going to be a wonderful source of vitamin C. So we're not necessarily here to talk about iron today. However, our leafy greens are a great source of iron, and vitamin C helps convert the iron in plant foods to be the most absorbable form. So the tomato is going to do that work for us right here. There's also a little bit of iron in the white beans that we're using, or technically Great Northern beans. So should have gone ahead and said that. To cut my tomato most safely, since they roll around, I did go ahead and put the flat side down so it's not rolling all over for me. That way then we can have another flat surface here to go ahead and continue chopping. So the technique we're using is actually technically braising. So what we're doing is we're using dry heat by sauteing first to cook these foods, and then we're going to add a cup of broth and let the liquid then cook the rest of the food in that way using a moist heat cooking method. So this is a combination cooking method, we would call it. And as everyone will see here, the way that these collard greens are going to cook quickly is not necessarily the cooking method. It's actually how we're going to cut them. So I'm going to cut them very fine. And the smaller that you cut something in general, no matter what it is, the quicker it's going to cook. So these are lovely tomatoes that I also got locally.
One of the things you talked about was vitamin D, and another thing to think about is that we really need to have vitamin D to absorb calcium. And a lot of people don't, our bodies do make vitamin D, specifically vitamin D3, but a lot of people don't get enough sun exposure without sunscreen on their skin to make the vitamin D3 that they need to absorb the calcium.
I was just going to ask you what your professional opinion is on that, the sunscreen and vitamin D3. Can you speak to that a little bit?
I mean, just from what I've read is that if your skin is exposed to sunlight through glass, like you're sitting in the car and there's sun on you, or if you put sunscreen on your skin, it blocks the production of D3.
Okay.
And so the best way really for most people that are indoors and don't have a lot of skin exposure is to take a supplement for D3, just because, and again, this is your expertise, but it's harder to get D3 in your regular foods that you eat.
Yeah.
What are your thoughts?
Well, it was more the sunscreen that I was kind of wondering about.
Yeah.
I do try to take that lunchtime walk when the sun is highest for that 15 to 20 minutes. I'm obviously a very fair person though, so I think trying to balance, do I need sunscreen? Or obviously just by trade, the vitamin D3 is more important to me than the sunscreen.
Yeah.
So
it's interesting. I think that, I'm fair skinned too, and I lean towards the sunscreen myself.
Yeah.
It's not hard to take a vitamin D3 supplement. And they're, a lot of them they have a USP symbol on them, which means that it's been through good testing. I think one of the things that people don't always know is that vitamins are not regulated by the Food and Drug Administration. And so if you do take a supplement, it's really helpful to make sure that it has a USP symbol on it. It means that it's gone through testing. And I think their slogan is something like, what's on the label is in the bottle or something like that. So you can really sort of hang your hat on the fact that you are actually getting something that your body can absorb.
Yes, exactly.
And the right dose.
Correct. In a clean manufacturing facility. So just to make sure that our garlic doesn't burn, we're actually going to add our tomatoes right now to give it a little liquid. So if you want to go ahead and do that, then I will get started on our collard greens over here. And these are big. Look at these beautiful South Carolina grown, first of the season collard greens. These are awesome. I'm really excited. So we're going to zoom in here to show you how to cut these. And actually, you know what? We just did another event with collard greens last night, and I think I'm going to do them differently. She showed me. So we're going to remove the stem, first of all. And the reason we're doing that is not only because the stem takes a little bit longer to cook, but it's more bitter. And that's usually why people don't prefer eating greens, because they have a bitter taste to them, a more earthy taste. So we're going to just go ahead and remove that. But I saw someone fold it in half and then kind of cut the stem out of the middle there, like so. So that kind of helps. And this recipe is, I have actually modified it, not only for calcium needs, but in general. But this recipe was first shown to me by our food service director, Mark Pierce, and it's a traditionally African dish. So sukuma wiki is the name of it, and it is, the way we're going to do this is I'm going to roll the collard greens. So I put about 6 of them on top of each other. I'm going to roll it really tight. And we want to do it long ways so it makes very small bite-sized pieces of the collard greens. If you did it the other way, you're going to get really long strings of it instead. And then I'm going to do a fancy, sounds fancy, really, I'm just going to cut them very, very thinly. I mean, these are maybe 1/4 of an inch wide. I'm just going to go down this roll here. This is technically a chiffonade cut, but what I'm about to show everyone here is that I like to call it collard green confetti. Yay! So it is just simply cutting this green in much smaller pieces that is going to make it cook really quickly. So I'm probably just going to keep doing these and add them as we go. So that way we can get them cooking, since they do. Whoops, I'm throwing collard greens at Cindy. So we can kind of get some of them started to go, because this then will take about 15 to 20 minutes, depending on how many collard greens we put in here. Like I said, I may not do all of them, but they just look so nice that I might do all of them. We'll see.
You already have pretty colors in here.
I do. Yeah, exactly. So we're working on, we've got green, we've got white, we've got red. And as mentioned, collard greens are a wonderful source of calcium. So that is part of the reason that we're doing this. But another part of the reason we're doing this is that I actually did not grow up eating collard greens. And so when Mark made this recipe, my motto now has become, I'm learning how to like something. So back then I would have said, I don't like collard greens. I don't know. But I smelled what was going on. I was watching what was going on. And I was like, you know what? All right. If he made them, I'm always willing to give it a try. And I loved them this way. So the interesting thing about it is, now that I found one way that I love them, I'm actually starting to even choose them out a little bit more. So maybe it's just that I got introduced to them and then kind of kept going from there. We say it takes about 10 tries for a child to determine whether or not they like a certain food. But as adults, there might be certain fruits and vegetables or beans or whole grains we've never even had 10 times in our life. So if we've never even had it at all, then I think that concept carries throughout adulthood.
Yes, absolutely.
So, and basically different cooking techniques and different varieties really can change the flavor of something a lot.
There we go.
All right, I might do, what do you think? Maybe one more batch of them?
Sure.
All right. We'll get some of these big ones here.
In just a second, I'm going to talk about some of the myths around osteoporosis and osteopenia. And I just wanted to mention that the information I'm going to be sharing comes from the Bone Health and Osteoporosis Foundation. They have an excellent website that you can access that really has information about all kinds of things, recipes, exercises, you know, basically directions for how to make your home more safe. So if you have a chance to use that as a resource, it's bhof.org. It's a great resource for clinicians and other individuals to just get the latest information.
Okay. We can send that out in a link when we send everyone the recipe.
That sounds great.
As well. Yeah, that's a good idea. Can we talk about that portion of it?
Sure.
The exercise?
Yeah.
And bone health?
Yeah. Well, exercise essentially, and I'll be doing a talk. We have a talk coming up in September, and I'll give you a little bit of information. I have it written down over there, but that talk is a lunch and learn that you need to register for at Spartanburg Regional.
Okay.
And I'll be going over a lot of concepts about exercise and fall prevention. But essentially, one of the things we forget about is that your bone is living tissue. And it's sort of a out of sight, out of mind problem, is that we don't think about our bone. But our bones are so important to us for a lot of reasons, not only the obvious things like giving us structure and, you know, it's something that our muscles pull on to help us move, but also part of our immune system is in our bones.
Yeah.
We store calcium, like I talked about, in our bones, and it's living tissue that's constantly being turned over. So we have cells that are called osteoclasts, which remove the older bone, and then we have osteoblasts, which are creating new bone. So most people don't realize that we have a new skeleton just about every 10 years. Our skeleton completely turns over. So it's living tissue, and it's something that can be definitely improved at any age. Doesn't matter if you are 15 or 85, you can do things to help your bones. And exercises in particular pull on the bone, and then weight bearing strains the bone, and the bone responds to those forces by creating stronger bone. So, yeah. So
but only if there's enough calcium to do that, right?
That's right. I mean, you have to have the environment where you've got the right nutrients. And also that at the same time, if you're doing exercises, but then you have 2 meals a day where you don't have calcium, you're taking calcium from your bones. So it's really the combination of getting the right nutrition and getting appropriate exercises. There are exercises that are detrimental if you have weakened bones. And so I'll talk about it at the luncheon. Yeah.
That's great. So if you have more questions about exercise, please reach out to us and attend that lunch and learn. That sounds like something I should go to. So one of the twists that I am putting on this recipe is actually incorporating figs. And figs are one of the fruits that are highest in calcium, kind of by a long shot.
That's great. Yeah.
So they're not something, now drying them, these are dried figs. So they actually have even more calcium because everything is concentrated. It's similar to raisins. So raisins have more minerals, they have more vitamins, but they do have more calories, they have more sugar because we're dehydrating them, we're taking out all that water. So 1 cup, you can get many more raisins than 1 cup of grapes. Figs are the same way. So there's a little more calcium in a dried fig than in a fresh fig, cup for cup, if anyone's interested in that. But 1 cup of figs has about 300 milligrams of calcium.
That's huge.
So it's a lot.
That's about like a cup of milk. Maybe a little more than a cup of milk. Yeah.
It's a lot. So I'm not sure how this is going to go. I have not done this before, but the incorporation of this sweetness that we're going to add to here with a lot of the savory flavors with the broth is going to rehydrate into these figs a little bit. I think it's going to work really well. So we've got curry powder, we've got broth. And then we've got our beans. So I'm going to go ahead and cut these up. And then, or you know what? Let's go ahead. How are we doing over here? Oh, we're looking good. Oh my gosh, I wish you guys could see how beautiful
It
these
is
look.
pretty.
It's really nice. It's great. Okay, let's go ahead and I think we're just ready to add our broth. So we'll go ahead and add our broth here. And we're going to bring this up to a boil. So I'm going to crank this up a little bit. And once it is boiling, I'll add our figs, our beans. And again, I chose specifically the white beans, whether it's navy or Great Northern, cannellini. Those are some different types. Those beans have more calcium than any of the other colors of beans. So some of the other different beans might have more protein or more fiber. In this case, we're talking about calcium specifically. So that's why I chose those instead of black-eyed peas, which might have been a more traditional Sukuma Wiki dish. So, but if anyone is very Southern, then this is, again, a very different take on. All right, I haven't decided how I want to do my figs yet. Let me see. All right, so I think I'm just going to dice these up here. I've got my nice thick knife.
I was just going to give a little bit more information about the Lunch and Learn. It's actually on Wednesday, September 6th. It's here at the Gibbs Cancer Center. And again, you need to register for that. It's from 12 to 1. There's also a fall prevention workshop being offered at Spartanburg Regional, and it's Thursday, September 14th. Actually, it's at the Pelham Medical Center, the Gibbs Cancer Center as well. So just reach out, and if you're interested, register for that. Probably have a link for that too, that they can check out more information about it.
Most definitely. SpartanburgRegional.com/events. So these are technically Turkish brown figs.
They look great.
They do.
I love figs.
I don't eat figs enough. So maybe that's where I saw that and instantly was like, all right, we're going to throw some figs in here too.
Yeah.
I like them fresh too. And they, I believe, are in season fresh in South Carolina right now too. So if you hit up some of the farmers markets, yes, it'd be a good time. And absolutely, you could throw the fresh in. But like I said, I was just kind of thinking along the lines of rehydrating them and getting that sweetness to kind of soak out into the rest of our dish here. So I chose to use 5 of them once I actually got in the store and looked at what size they were going to turn out to be. But you can certainly use less. My original recipe, the way I wrote it, said 3 because I wasn't quite sure. So we can always adapt a recipe. It's just a suggestion. Do we have any questions that have come in, Terry?
Well, if this is a good time, I'll go ahead and just talk about some of the common myths about osteoporosis.
Sure.
The first one, and again, this comes from the Bone Health and Osteoporosis Foundation, is that most people don't need to worry about osteoporosis, but the reality is that osteoporosis is actually considered an epidemic in this country. There are 44 million Americans right now that have low bone density or osteopenia. So the reason that's important is because, unfortunately, in the United States, 1 in 2 women will suffer a fracture from osteoporosis in their lifetime, and up to 1 in 4 men will suffer an osteoporosis fracture. And unfortunately, fractures are largely preventable and they're certainly treatable, but it's just kind of, like I said before, it's a silent disease. A lot of people don't know they have bone loss until they get a fracture. And so it kind of goes neglected to think about your bones need nutrition throughout your lifespan. In fact, one of the statistics they point out here is that 2 million new cases of fracture occur per year, which is more than the number of new heart attacks in this country. So it's kind of this under-recognized and just not as much in the forefront for people as it should be.
Right. Especially when we think about just how that would affect the rest of your quality of life, because physical activity is so good for reasons besides your bones, you know, your mental health and weight management and your blood sugar and all these things. And if we have a fracture, I mean, even cooking, you know, that it just makes everything harder. So if we can prevent it from happening, definitely want to do that.
one of the things, kind of to echo what you're saying, is that another myth is that you don't need to worry about osteoporosis if you break a bone from a serious fall or accident because it's just a fracture. But the reality is, like you were saying, is that broken bones in people over the age of 50 are often the first sign that they have bone health problems.
Oh,
And
wow.
sort of to echo what you were saying is that people that do suffer a fracture from osteoporosis, if it affects the spine or if it affects their hip, those fractures can go on to lead to a lot of disability. In fact, about up to 30% of people who have a hip fracture die within a year of that hip fracture. And unfortunately, about 25% end up being placed in a nursing home. So it has a tremendous impact on your function and your health, which is why start thinking about it now, and really start thinking about it at any age to reduce your chance of getting a fracture.
Is it true that your peak bone mass is around maybe late 20s, even up to 30? So does that mean that that's the most bone you'll have for the rest of your life?
Yeah,
is that how that works?
That's a great point. And one of the things we forget, there's a quote out there that says, osteoporosis is a pediatric disease with geriatric consequences, meaning that if you're not developing your bone mass in your youth, by the time you get to, like you said, about your mid-20s, I always use the analogy, and others do too, is that it's like putting money in the bank when you're younger. And then what happens is at about mid-20s is that there's just this slow, steady decline where you're no longer building your bank account, so to speak, is that you're slowly withdrawing it. Yeah. So particularly now when our children are less active, I always bring up the point that the iPhone is 16 years old. And so even our kids that go out and play sports, if they come home and sit there for the rest of the evening, like if your leisure activity is just sedentary, so we're seeing a lot more childhood obesity. And related to that, which you can't see, is they're not building their bones the way they should over time. And so there's actually estimates that the fracture rate is going to increase significantly in the next 20 years. And remember, I just said right now, we already have millions of people in America that have osteoporosis. So it is serious.
That is not something I had thought about related to the pediatric obesity.
So it is worrisome, and that's why we have to think about not only nutrition for those of us who are now health conscious, maybe but thinking about your children too, because a lot of them, and again, this is your expertise, but there's sodas, there's juice boxes, there's these fast foods that they can grab that maybe are not going to get the same amount of calcium and vitamin D in their diet that they should. And I'll talk a little bit about what the recommended, daily allowance is for calcium, but for children, it's even higher than postmenopausal females. So so this is good for the whole family.
This is a good reminder for me. Because my daughter has just stopped drinking milk. So she just doesn't want it. She doesn't, it's not because we've done anything, but I'm trying to get her to, try some of the other plant milk varieties at least to see if I can get her on that. And she's just not, I don't know. And I don't know what happened. Maybe we served her spoiled milk or something and I can't figure it out. But she just woke up one day and it was like, nope, I'm not having that. So we will make a concerted effort to get her, make sure she's getting calcium in other ways. So,
and I have 3 kids of my own who are older now, but I remember having to switch to chocolate milk, and then they got tired of that, and then it was, well, let's try, the drinkable yogurt. And just thinking about things to kind of stay ahead of them. Almond milk, coconut milk, they have calcium in them too. So
smoothies have been kind of my saving grace right now. Smoothies and yogurt are working. So
that's great.
That's great. But
just kind of echoing what we're talking about, a lot of people have the misconception that osteoporosis is a problem for little old white ladies. And the reality is, just like I was saying, is that we see predominantly osteoporosis in women, but we also see it in men. Remember, I said 1 in 4 men can suffer a fracture in their lifetime. And the other thing is it's across ethnicities too. So it doesn't matter what your race is or gender, you really should be.
Everyone has bones.
Everybody's got bones. That's right.
So Can we dive into that a little bit deeper
Yeah.
too? Is it women have such a higher risk? Is that because estrogen plays a role with calcium?
Yes.
Or
Yes. There's a kind of a number of factors related to that.
okay.
Women, in general, have a smaller frame, and so we have less bone
Okay.
to begin
Okay.
with.
That makes sense.
Puberty lasts a little bit longer for men, so they're adding bone to their bone bank for just a little bit longer than women are.
Okay.
And then one of the key things that you brought up is that women have hormonal changes. So right around the time of menopause, when we lose the hormone estrogen, estrogen is an important hormone to block those cells called osteoclasts, which break down bone. And so all of a sudden you remove estrogen.
Okay.
And for women who started out with less bone, now the bone is being removed more quickly than in males.
Okay.
So, but whether you're male or female, keep in mind osteoporosis is not a part of the normal aging process, right?
Okay.
We should lose bone slowly over time, but we really shouldn't be osteoporotic. It's not just an automatic.
Yeah.
Right? So you can do things. I mean, there are genetic factors, but obviously
Yeah.
diet and physical activity have a big part.
Are you familiar with the blue zones?
No.
Okay. So the blue zones are the areas of the world where people live the longest, healthiest, disease-free lives. And we've scientifically, National Geographic has scientifically discovered 5 of them. So meaning they have the actual birth records and death records and the health data and all of this to actually prove the disability-free years. And so these are centenarians, 90s, 100s, just simply passing away in their sleep. And so one of them is in Costa Rica, one of them is in Japan, Italy, Greece, and then actually Loma Linda, California here. And so one of the interesting things about that is you just see, I mean, part of it is that these people are just naturally moving forever. So they're walking, a lot of them live in these very hilly neighborhoods where a walk is actually more like what we would call a hike, even if it's just down to the market or down to their friend's house or to church or whatever it might be. And then even just the water. So in Costa Rica specifically, they found they live under a limestone bedrock. So all of their water is really high in calcium. And it broke their little reader. They had to, I think, dilute it by 3 times or 4 times just to even read the amount of calcium that was in their water that they're using for everything from tortilla making to coffee to simply drinking by itself. So kind of interesting to think about too. You see them getting up off the floor, you see them riding bicycles at 80, you see them. So it is, to your point, it is possible. It's not necessarily meant to be part of the aging process.
No, exactly. And I love your point about walking. That's a simple activity that people can do that you don't have to have special equipment. It's easy to do. You start with a little bit and then you build up slowly. So that's just an easy something you can start right away to get that weight bearing through the extremity.
So important.
Yeah,
that's great. I'm gonna stir our collard greens here. I think I've given them a little while, kind of see how we're doing.
Here's myth number 4. People with osteoporosis can feel their bones getting weaker, and that's not true. Osteoporosis is a silent disease, meaning that there's no ache or pain associated with bone loss. You just don't know it's happening. It's happening in the background. And even if you have an X-ray, X-rays are not sensitive enough to detect if you have osteoporosis. They can certainly tell you if you have a little bit of bone loss compared to the average bear. Really, the best test to get to assess your bone health is a DEXA scan. And the next myth is that osteoporosis, the test to determine if you have osteoporosis is painful and exposes you to a lot of radiation, which is false. So what the Bone Health Foundation says is that really if you're 65 years old, if you're female, or 70 years old, if you're a male, you should get a DEXA scan because, again, it's a silent disease and you don't know if you have it. The test takes about 5 minutes and it's actually less radiation than getting an X-ray. So,
there we go. So
it's very quick and simple.
Is that something most doctors are going to refer patients for, or is that something you might have to advocate for yourself a little bit more, ask for just to make sure?
I think that's a great question. And really, I think you do have to advocate for it. It's a little bit difficult because osteoporosis is treated by a lot of different practitioners. It may be if you're a female, maybe it's the gynecologist that you're seeing that's thinking about it.
Okay.
If you see an orthopedist, they may think about it. If you're a primary care practitioner, they may think about it, but there's not necessarily somebody who's really that clear, specialty. So you really do have to advocate a lot of times.
Yeah.
Particularly if you have other risk factors for osteoporosis, you may want to get that DEXA scan earlier. So, yeah, that's something definitely to think about. But advocate for it, because a lot of people, it just kind of gets lost through the cracks. And like I said, many people don't know they have osteoporosis until they fracture. And like I said before, it's not that you can't do anything at that point. It would just be better to prevent.
It, sure. Yeah.
All right, we already talked about children. One of the myths is that children and teens don't need to think about their bone health, but we mentioned already that you do. And keeping in mind that if you have a higher peak bone mass when you're younger, you have a much less chance of getting osteoporosis later in your life. So, all right, here's a couple of other things just to think about in terms of if you, one of the myths is that, okay, well, if I exercise and I eat right, then I won't have osteoporosis.
Sure. Okay.
But unfortunately, there are a lot of other risk factors. So in terms of advocating, like you were talking about, if you are petite, if you're smaller, a smaller frame, if you have a family history of osteoporosis, there are some medical conditions associated with osteoporosis. So if you have rheumatoid arthritis, if you have irritable bowel syndrome or other autoimmune conditions, you should also think about it.
Yeah, probably because of the absorption issues just with the calcium from the beginning.
Absolutely.
That makes sense.
Yep.
Yeah. Okay.
All right. We already talked about the seriousness. Just two other things I had to kind of talk about were taking extra calcium supplements can help prevent osteoporosis. And the reality is that that's not true. You don't want to take extra calcium. That's not going to change your incidence of osteoporosis. You really want to take what's recommended for the daily intake. And so, as we said before, if you can get it through your diet, that's the best way. For men between the ages of 50 and 70, 1,000 milligrams is recommended. For women over 51 and men over 71, 1,200 milligrams is recommended per day. And then back to our younger adults, ages 9 to 18 years, 1,300 milligrams is recommended per day. While they're building up that bone health.
Yeah. Okay. So even in that case, we kind of mentioned that 500 milligrams per meal or 500 at a time concept, but that would get you pretty close or maybe a little over what that most of those.
Yeah, if you did 500 at each meal, that would be plenty.
Yeah.
Some people are reluctant to take calcium. I remember in the press several years ago, there was that issue that, well, if you take calcium supplements, that's going to increase your risk of heart disease. But there isn't good evidence for that. There are studies that showed that, but then more studies came out. And now, by far, the majority of the research indicates that taking a calcium supplement or having sufficient calcium in your diet does not affect your risk of heart disease. I think, of course, if you do have a heart condition, you should talk to your doctor one-on-one about it. But don't be worried about taking calcium or eating calcium if you have heart disease.
And I think where that's stemming from is probably the fact that we know that calcium builds up in the plaques of the atherosclerosis. So it's a part of that atherosclerotic plaque. In other words, that cholesterol, there are immune cells there, there's inflammatory cells that come and try to help. And calcium just gets stuck in there along with those other items. So I think that's probably where some of that was coming from. With, maybe just figuring out that calcium was a part of that process, but I think maybe not understanding that it's just kind of a bystander that's getting pulled into there.
That's right. So, not necessarily that you have to stop eating calcium because then you're going to have another problem, which is with your bone health.
So exactly. All right. Oops, I should have I accidentally put away my I should have probably gotten a spoon instead, but I'm going to go ahead and spoon some out on these plates, and we will zoom in so you can see. Okay, thank you. Yep, great.
There we go.
All right, try and make it a little. Try not to make too much of a mess.
There we go.
There we go. All right. And then here. I tried to pick contrasting colors, but our colors changed a little bit, so probably would have been. All right. So these are really hot, so we will go ahead and give them a minute to cool off before we taste them. So
Yay.
let me show, we'll go ahead and show everyone what they look like there. Let me fancy up my plating here a little bit. So I think I mentioned that what we also added was curry powder. So a tablespoon of curry powder is really what's going to give a lot of these things the flavor. I added 1 cup of broth. So while that 1 cup was around 700 milligrams of sodium, remember that this dish is going to be divided at least by 4. We didn't add any other salt. And more importantly, I forgot to top it with our sesame seeds, which are another fabulous source of calcium.
Oh, that looks so pretty.
So let me find my note here. So an ounce of sesame seeds is 280 milligrams of calcium. So another very high source, but that is 3 tablespoons. So probably you're not going to eat 3 tablespoons of sesame seeds. However, tahini is ground sesame paste. So it's kind of like the version, the closest equivalent is peanut butter and peanuts. So sesame seeds tahini is ground up sesame seeds. So that would be highly concentrated in calcium as well. And most people may or may not know that traditionally hummus, the chickpea dip or spread, is made with tahini. So you can hopefully get a little bit of calcium from your hummus as well. So
Great.
there are our final product there, and I'm gonna have to take a bite. You are more than welcome to as well, Cindy. See what you think. Did I ask you if you liked curry powder yet? You can't remember.
I love curry.
Okay.
I haven't cooked collards before.
Yeah.
And I don't eat them a lot. So
it's a very different way to use curry powder too. So.
Oh, it's so good.
Oh my gosh. The figs were a great idea, everyone.
Oh, I didn't get a fig yet. Hold on.
Okay, you're gonna need a fig. Oh my gosh.
Get that sweet and savory.
Exactly. And so that's how we make plants taste good. We have a little bit of salt, a little bit of sweet, a little bit of crunch, a little bit of soft, a little bit of, there's just a little bit of everything. Savory. Absolutely. The collard greens I have learned to like them a little crunchier. So, but you can obviously keep cooking them to the point where they would.
Nice. Yeah.
Okay. I'm glad you think that.
Yeah,
so
got a little texture to it, but it's really good.
Yeah. And again, that's all with how we cut it.